Hello and welcome to Quinn's Harm Reduction Based Education. In this session, we'll be discussing overdose and overdose prevention. And more specifically, we'll discuss what an overdose is and what kinds of drugs are more likely to cause an overdose. We'll look at the signs and symptoms for both depressant and stimulant type drug overdoses. We'll discuss how to respond to an overdose by detailing some strategies you can use in the event of an overdose. We'll also look at what you can do to help prevent an overdose and keep safe, and we'll discuss the life-saving drug used to reverse the effects of an opioid overdose, naloxone. An overdose is a biological response to when the human body receives too much of a substance or a mix of substances. Overdoses can be fatal or non-fatal, intentional or accidental. Research shows that most overdose deaths occur more than an hour after taking the drug, and that usually other people, such as friends or family, are nearby. However, in most fatal cases, there is no intervention before death. This is primarily because most people are not equipped or educated on how to respond to an overdose. For every fatal overdose, there are 20 to 30 non-fatal overdoses. Some potential risks of non-fatal overdose are an acquired brain injury caused by not enough oxygen getting to the brain. Other risks include breathing in fluid when sedated, which leads to fluid on the lungs, as well as long-term muscle and nerve damage from lying in one position for an extended period of time. There have been approximately 35,000 overdose deaths in Australia since the year 2000, with approximately 2,227 overdose deaths in 2019 alone, 1,644 of which were unintentional. Deaths from overdoses have outnumbered the road toll since 2014. The two kinds of overdoses we will be focusing on today will be depressant-type drug overdose and stimulant-type drug overdose. However, any drug taken in excess or combined with other drugs has the potential risk of causing an overdose. Some combinations of drugs, such as depressants, can increase the risk of overdose. For example, using heroin and benzos such as Valium together. Before taking any drug, it's important to know about the drug you are taking and its effects. The majority of opioid overdose deaths, around 70%, involve pharmaceutical opioids such as endone, oxycontin, or fentanyl, more than double the number of heroin-related deaths. Depressant substances can reduce arousal, stimulation, concentration, and coordination. These substances affect the central nervous system, slowing down the messages between the brain and the body. They slow down a person's ability to respond to unexpected situations, and in small doses, they can cause a person to feel more relaxed and less inhibited. However, in larger doses, they can cause a pale skin color, bluish tinge to the lips and fingertips. The person becomes unresponsive with slow or shallow breathing or not breathing at all, snoring or rasping sounds, seizures, locked rigid mouth or jaw, vomiting, drowsiness, unconsciousness, and death. If you believe someone is having an overdose, you should call an ambulance immediately by dialing 000 if you're in Australia or 112 from a mobile phone. Tell the operator the person has overdosed. Put the phone on loudspeaker and stay on the phone following their directions. Clear their airway. Perform rescue breaths. Give the person naloxone if they have had opioids or if you suspect that they have had opioids. Place them in the recovery position. Stay with the person until an ambulance arrives. Naloxone, also known as Narcan, is a life-saving medication that temporarily reverses the effects of an opioid overdose. Naloxone won't work on all depressant substances like GHB or alcohol. It will only reverse the effects of opioids, such as heroin, codeine, and morphine, for example. Naloxone works by blocking opioid drugs, such as heroin and oxycodone, by attaching to the opioid receptors in the brain. Its effects are short in duration, lasting approximately 30 to 90 minutes. If you or anyone you know are using opioids, it's strongly recommended that you carry naloxone. It is a safe and easy-to-use medication and is available in a preloaded syringe or as a nasal spray device. Quinn Harm Reduction staff can provide a more detailed training on naloxone along with a free supply of naloxone. If you are interested in getting some more information, please speak with Quinn NSP staff. Overdoses are preventable, and there are some things you can do to help prevent an overdose. These include 1. Avoid mixing or using multiple drugs. Mixing substances, especially opiates and benzos or alcohol, can be deadly. Use around friends or people you trust and in a safe environment, somewhere you feel comfortable. Avoid using alone or without anyone knowing where you are. Remember, if no one is around, they can't call an ambulance or provide first aid. 2. Know your limits. If you haven't used in 2 to 3 days, your tolerance for drugs can drop. This is important to remember if you have just been released from hospital, detox, rehab, prison, or any other situation where you may not have used drugs for a number of days, weeks, or months. You should halve your hit and start small. Remember, you can always use more, but never use less. 3. Know the strength of the drug. Purity and quality of drugs can change. You can never be certain what's in your substance or the strength of it. Going to a new dealer or buying online may increase your risk of overdose, so it's always helpful to ask your dealer about the strength or ask other people that may have scored the same gear. 4. Always carry naloxone. If you or people you know are using opioids, it is important to carry naloxone. Stimulants increase the activity of the central nervous system, speeding up the messages between the brain and the body. Stimulants are a category of drug that increase alertness and heart rate, producing an effect of increased confidence and energy. Large doses of these drugs can result in anxiety, panic, seizures, headaches, stomach cramps, aggression, and paranoia. Examples of stimulant drugs include methamphetamine, cocaine, and ecstasy or MDMA, among others. When people use high doses of stimulants, such as amphetamines, some psychological effects may include confusion, anxiety and agitation, impaired cognitive and motor performance, aggression, and paranoia. Some physical symptoms of stimulant overdose can include racing pulse, profuse sweating and body chills, excessive thirst, breathing difficulties, nausea or vomiting, chest pain with a pounding heart. As overdose progresses, the person may stop sweating and become very hot. Seizures or fits, stroke, headache, loss of balance, difficulty speaking, numbness or partial paralysis, and unconsciousness. Recognizing and responding early to these signs may prevent further mental or physical harms, including death. If someone is experiencing these signs and symptoms, then medical attention should be sought to prevent possible toxicity. In the interim, aim to cool the person down by sipping water, avoid bright light, loud noise, and seek medical assistance. Remember, naloxone won't work on a stimulant overdose. Naloxone only works with opioids, as discussed previously. Toxicity can occur when a person has overdosed on amphetamines to the point that the drug is toxic to the brain and body. This can lead to serious physical complications such as seizures, cardiac arrest, or organ failure. Amphetamine and stimulant toxicity is a serious medical condition that can result in physical and mental health symptoms that require medical treatment. Untreated amphetamine toxicity can result in heart failure, seizures, coma, or even death. Knowing what to look for and how to respond can help to reduce these harms. We'll discuss how to help someone who may be experiencing a stimulant overdose in the next slide. If you suspect someone is experiencing a stimulant overdose, call 000 or 112 from a mobile phone. And if they are unconscious, place the person in the recovery position. Other ways you can help include make the area safe. Use a cool, wet towel and compress on the back of the neck to cool them down. Move the person from bright lights, bystanders, noise, or excessive light and heat if possible. Avoid sudden movements and confrontational situations. Sit beside them, not in front. Discourage them from smoking as it will impair their breathing. If they are fearful, reassure them. Do not dismiss delusional thoughts. Remember, it is real to them. There are some simple things you can do to help prevent stimulant overdose. Use drugs around friends or people you trust and in a safe environment and somewhere you feel comfortable. Remember to eat well, then wait 20 to 30 minutes before you use. Be aware of overheating and try to cool down and chill out regularly. Remember to keep your fluids up, but don't drink too much. 1 cup of water, 250 ml per hour when resting, and up to 500 milliliters per hour when dancing or active. Sleep or lie down and cover your eyes during the next 24-hour period. Many of the negative effects of stimulant use are caused by sleep deprivation. Factor in and plan recovery time before you need to do another activity. When using any types of drugs, remember always to avoid using alone. Always halve your hit if you haven't used for a while or you're getting gear off someone new. Always carry naloxone if you use opioids or if you're around people who use opioids. Always call an ambulance if you witness an overdose. Remember to eat, sleep, and drink water. Speak with an alcohol and drugs worker or needle and syringe program worker if you require any support. Always look out for your mates. There is a lot of information available about overdose prevention. If you need to talk with someone about overdose, contact Quinn on 1-800-172-076 or visit one of our needle and syringe programs for a chat. Visit www.quinn.org for our locations.